okay?
Okay.
Joe, call 911.
It's not looking so good.
Joe. Joe.
911? Yeah, can I get an ambulance over here? There's been an accident. Can we get an ambulance to Laredo College? I think there's a medical brace. Okay. Brittany, can you go get it? Yeah, I'll hold.
Joe, let me help you.
All right.
We got him in the brace.
You got him?
Yep.
Okay, guys, let's take him to the emergency room.
Hey guys, found the elevator.
What floor, guys?
First.
All right.
Today, we're going to be discussing the difference between tetraplegia and quadriplegia. Do you know the difference? Angel, can you tell me? Correct. Tetraplegia and quadriplegia are the same. They're both prefixes for four, meaning all four extremities are of no use. We're going to be delving a little bit into that. So those who suffer spinal cord injuries have a 17% mortality rate. When you're dealing with spinal cord injuries, there's instances between complete and incomplete. Complete is when all four extremities are of no use at all whatsoever. Incomplete, they have no use of the lower extremities and some use of the upper. They can move their arms and hands, but they have difficulty with their fingers. In some cases, they can't use them at all. So, it is more common in males by 80%. The average age is around 41. 30% of spinal cord injuries visit the hospital 1 to 2 times after injury. So here we have mechanism of injury. There are many ways that a spinal cord injury can happen. The most common being a motor vehicle accident, or in our case, a hacky sack. Very dangerous. So the annual cost to treat spinal cord injury patients is around $816,000 for dealing with C5 to C7. Here we have a diagram. We have C5 to C7. So how common is it? Around 12,000 people per year suffer spinal cord injuries. Our unlucky patient suffered an injury right here in the C7 column.
All right, so we can go ahead and talk about some signs and symptoms on the scenario that we have, in which case it'd be incomplete tetraplegia of C7, at the C7 level. So some common signs and symptoms include burning to the back and shoulder. So they'll feel it burning to the back and shoulder. It's pretty self-explanatory. Uncontrollable bowel and bladder, and that's due to the lesion at the cervical level. Will disrupt anything lower. Ability to extend the shoulder, arms, and fingers to a slight degree. However, their dexterity for their fingers is compromised, so they won't be able to actively move their fingers as much. Rather, they'll be able to rely on the tenodesis action, which we will discuss later on in the video. And there's an obvious lack of motor and or sensory function. So now, ways to identify a spinal cord injury, which of course would be undertaken by the medical doctor, not really our scope of practice, but just to know a little bit about it, is we have a complete physical and neurological examination of the patient, front to back, side to side. They'll look over the patient completely and see any dysfunctions. There's also some imaging studies that can be done to the patient, which in this case would be either an MRI, a CT scan, or an X-ray to determine the level of damage, any sort of vascular, soft tissue, bone, or neurological damage that's happening at the incomplete lesion, and just to get an image of how bad the condition is. How's it looking, Doc? Not good, my dude.
Doc, what happened to my friend?
Your friend had a serious hacky accident. Took a sack to the jugular, and it's not looking good. I can't feel my legs. I can't even move my fingers. You okay, dude?
Don't worry, dude. We got a great PT department. We're gonna refer you to, my man. It's gonna be okay. You'll get back to your hacky sacking days in no time.
I really hope so, Doc.
I hope so too.
All right, my dude. We're gonna try and sit you up, okay?
All right.
Try to go ahead and use your arms as much as possible.
That's hard, Doc.
Come on, you can do it. I don't feel so good. Oh, okay, let's get right down to having hypotension. Nurse? Yes? Go ahead and recommend treatment for the tilt table. Sounds good?
Patients with this type of spinal cord lesion will have physiological responses that are important to note even when they're in physical therapy. The most important one of them is autonomic dysreflexia. Autonomic dysreflexia is an increased response from the sympathetic nervous system due to the noxious stimulus. The patient will report the following: blurry vision, intense headaches, nausea, cold, and clammy skin. To relieve the autonomic dysreflexia, first identify the stimulus, then remove it. After that, you can raise the head of the bed to 30 to 45 degrees if the patient is supine. Check vital signs every 5 minutes if possible. Never lay your patient down supine with autonomic dysreflexia, as that will make things worse. If symptoms return, then activate 911. So if they have bladder problems, these patients have an inability to voluntarily urinate. Patients with incomplete tetraplegia would have to use a catheter in order to void their bladder or have a schedule to complete a bowel movement. This will require monitoring from the PTA, as complications from the catheter can lead to autonomic dysreflexia. Next, sexual dysfunctions and negative psychological reactions. Patients with spinal cord injuries go through an adjustment phases of loss and grieving similar to those found in the Kubler-Ross phase of grief. The PTA must take this into account when a patient is visibly frustrated or cooperating in their HEP, or not cooperating in their HEP. As a PTA, we must discuss these aspects with our patients and maintain proper communications between the patient, PTA, and PT to achieve a higher quality of life. Hello, Mr. Mata. My name is Brittany Dominguez. I'm a student PTA, and I'm going to be working with you today, okay? I'm going to move you onto the tilt table, but I need 2 helpers first, okay? Guys?
Hello, Mr. Mata.
How you doing? Not so good. I'll fix you up right now.
Hey guys, ready? On 3, we're gonna move them over. 1, 2, 3. Okay. One, 2, 3. Okay. You look good, Mr. Mata.
How you feeling?
Just a little dizzy.
Okay.
Dizzy? Okay, we're gonna leave you laying down while we finish prepping you, okay? Okay guys, let's go ahead and move this over. And Omar, if you can help me on the other side. Mr. Mata, what we're gonna be doing is we're gonna be picking you up, okay? Little by little.
Move your arm, okay?
Okay, Mr. Mata, we're almost done setting you up. Okay, guys, last thing. Okay, now we're gonna put the BP cuff on you, Mr. Mata. How are you feeling?
Okay.
Okay. I have this on you to check your BP, your blood pressure, okay?
What's this machine for again?
This is to help you stand up, okay? So you can remember that feeling. Okay, so Charlie, we're gonna pick him up to 30 degrees and you let me know when it's on there, okay?
First.
Let's bring this up.
Hold on here, okay?
Is he grabbing you to the other side? We're good.
Yes.
Okay, so I'm gonna go ahead and pick you up, Charlie. You let me know when it's 30 degrees. Okay, Mr. Mata, how are you feeling?
A little dizzy.
You dizzy? Let me go ahead and check your blood pressure, okay? It looks a little bit low. Okay? Then go ahead and put you down. Mr. Mata, do you feel a little bit better? We just tried picking you up. Your blood pressure went down a little bit. How are you feeling right now?
A little better.
A little bit better? Okay, just take a deep breath in. In through your nose, out through your mouth. Okay, are you ready to try this again? Yes? Okay, Charlie, so go ahead.
I want to get better.
Yeah, that's our goal, okay? You ready? How are you feeling so far? A little bit better? Okay, I'm gonna check your blood pressure again. Okay, it looks like you're doing a lot better. Are you ready to go up a little bit more?
Let's try it.
Let's try it. Okay, let's go for it.
That's it.
Okay, right now we're at 60 degrees of standing.
How does that feel?
A little dizzy.
You're a little dizzy?
Dizzy?
Check your blood pressure. How do you feel?
Okay. Went down again.
5 degrees, bring them up 5 degrees.
Mr. Mata, how are you feeling?
A little dizzy. Did I pass out again?
Yes, but it's fine. This is the progress that we have to take in order for you to get better, okay? Let's check your blood pressure.
The lower I am, the better I feel.
Let's see what's the maximum number of degrees that you can handle.
I don't think I can go past that.
That's fine. Okay, your blood pressure looks better here. We're gonna time how much you can stay here. Okay, Mr. Mata, we're gonna go ahead and bring you all the way down.
Okay. I already want to go back to bed.
That's the next step we're gonna do.
Back.
Okay, Mr. Mata, I'm gonna go ahead and unstrap you. Get you ready to go back to bed. Okay guys, let's move the table. You can take a nap right now. Let's go ahead and move the pillow out of his head. Go ahead, Omar. On 3 guys, are you ready? Okay. 1, 2, 3. One, two, three. How are you feeling, Mr. Mata?
Ready for bed.
Okay, we're on here. Okay? How are you feeling right now?
Fine.
Good? Ready to take a long nap?
Yeah. I'm tired.
Mr. Mata, how you doing? We're gonna do some therapy today, okay? My name's Omar,
My name's Charlie.
and we'll be working with you today. Is that okay?
That's fine.
Okay. So here we have you laying on the mat. We're gonna be working on some positioning and fall prevention, or teaching you how to fall, and then rolling on your side. We're gonna be doing some of that, okay? So first things first, how do you feel? Do you have any pain?
Just a little sleep.
Okay. All right. So we're gonna attempt to get you on your elbows. Can you go ahead and show me how you would get on your elbows?
I don't think I know how, but I can try it.
Well, okay.
Okay.
He's gonna show you actually how to do it.
Relax.
So you wanna look towards this side?
So we're here. We want to prop up on the elbows like this. You see right here? It may be difficult. We're gonna try. And of course, me and Charlie are here to help. So, let's see if you can replicate.
One at a time. One arm. There you go. That one. Do this one. Try to bend it. There you go. Just a little bit of help here. Right now, okay, this one. Got you. Right here. A little bit of just in case, okay? Alright.
That makes me feel better.
Alright. How do you feel? Good? Relax. Breathe in through your nose, out through your mouth.
Okay, let's rest.
Slowly. One at a time.
How'd that feel?
It's tough.
Any pain on the elbows?
Just a little bit, but I already want to get up.
That's good. We want you to get up.
Okay, so you ready to advance? We're gonna try to get on our hands this time. Similar, but a little bit more steps. Charlie will show you how.
So it's the same thing as the elbows, but this time you're gonna pick up yourself with the hands. You're here, you already know how to do the elbows, so one at a time. So once you get to the elbows, the same process, but this time you're gonna pick yourself up with your hands one by one. And try to move it as back as you can so you can hold yourself like this. I know you don't have much flexion in your fingers, so you're gonna be like this and it's fine. You could just hold on yourself like this.
And then from there, you move your arm a little bit more forward.
Slowly. Don't go too fast. Take your time. Sit up straight. And look straight ahead. Breathe in and out. And once you're going back, slowly, one at a time. One hand at a time, go back. You go back onto your elbows. And release. Just like that. Think you can do it?
I'll try.
We're here to help you out. Okay. Okay. So what's the first thing you do?
Come up on elbows.
Yep. We're here to help, but we want you to do everything, okay? We want you to be more independent. There you go. You got it? Great. There you go, see? Okay. Take a deep breath in. And out. There you go. Now let's use the hand, okay? Gotta get up. There you go, see? Look. Right behind you, okay? Forward. Now look straight over there to the water. There you go. How does that feel?
Okay. So from this position, let's say you can. Let's say you're at your max, which you're not, right? You're fine. So if you're gonna fall, you're gonna fall. So the best way to do it is tuck your chin in like you're doing, and then fall back. There's pillows. There's pillows. Fall back. Go ahead and fall back.
That's scary. I don't want to fall back. I don't want to hurt myself again.
There's pillows. There's pillows. We have a lot of pillows.
Okay.
We're right here.
What do I do with my hands?
Just let them go. We'll help you out this first time, and then we'll see if you can do it on your own. Okay?
Slowly.
Let go. Let go. Let go. Let go. Let go.
Use your hands.
Right here. Right here.
See? Wasn't that bad, was it?
I think I can do it.
See, you can do it.
Okay, let's
On
get
your
up
own.
again. Gotta pick up yourself.
Let's move the pillows forward. All right. The pillows are there again.
We're gonna ease off, okay? We're gonna just slowly move our hands.
Okay.
So
And then
your
just
chin
fall
in.
back.
You're tired. Can't no more.
There you go.
Good job, Mr. Mata. All right. Now we're just gonna take three deep breaths. In with your nose, out with the mouth. Relax. Okay.
So let's get up, 'cause I noticed you were actually coming to this side over here.
Okay.
So in case you do fall to the side, we're gonna show you. So get up. One at a time. There you go.
It's getting a little easier.
Yeah, the more time it's
This makes
okay.
perfect.
So So what you're gonna do is you're falling to the side, just let this go so that way you don't land on this arm. Just try to pick up over here and slowly just land over here to the side. Just like that, right? Okay, so remember how we rolled in the beginning? So you're actually gonna do that to go back onto your back.
Okay, so it goes.
Uh-huh. Let it go. And use your momentum to go back. We're here to help you let it go. See? That was all by yourself.
We're gonna work a little bit on our rolling. I noticed you're pretty difficult. We're gonna go over that again. Okay.
But the more times you do it, the more of an expert you're gonna become.
I just feel a little twisted up.
Okay. So you could actually use your elbows to move yourself.
Okay.
We want to help you out as much as we can, but we know that you're gonna be by yourself eventually, so we want to make sure you do everything by yourself. So not every, most of the times you're not gonna have somebody there. So
Yeah.
okay, let's move this out of the way.
So try to pop up on your elbows, like we showed you.
There you go, and then just move to this side over there. Usually happens.
That's fine, that's fine. As long as being one track, little by little. There we go. Can't take a deep breath. And continue.
Just take your time.
Right there.
How do you feel? Better? That's
Alright.
good.
So let's work on our rolling. How do we teach you how to roll?
Told me to put my hands here. Where do you want me to roll?
Move up just a little bit higher.
That's the size I can take.
Okay, that's fine.
First roll to me.
Remember, get that momentum going.
There you go. Alright, we're gonna go back. Coming out. Coming out to go back.
Good job. Take a little break.
Now we're gonna go to Charlie.
So do the same thing. Use that body momentum to come to my side. Go, it's all you. It's all you.
Sides ain't gonna work.
Yeah, I know. How do you feel? Good. Great. Ready to go back? Okay. Ready? 1, 2, 3.
Go, go, go.
Good job, Samantha. You're doing really good.
Okay, just move your head in and just move your head to the side. Oh, you're straight. Go.
Alright, so
So
that
you're really, really good.
That concludes our therapy for the moment. Right now we'll assist you back to your bed. Alright? You have any questions for us, Mr. Mata? Oh, one thing I forgot to mention. Do you have a phone on you?
Yeah. It should be in the pocket.
Okay.
So it's not there.
That's fine. I'll show you with my phone whenever we get to your room. So I want you to go to the camera feature on your phone. You know how to access that?
Yeah.
Okay, and can you grab it? And just like that, just for purposes. So what you can do, you can roll just a little bit here. You can see if you can reach.
I can't reach that.
You can try to scan an area because you're always on your bed and these are some pressure spots for you. You want to make sure that there's not any redness if you notice on your phone, report them to the nurse or a family member immediately.
It's mostly in the bony area, so you feel it right here in your shoulder, your elbows, you're laying down right here, so it's right here in your wrist. Here at the bottom, the heel. So those are the parts you want to see when you're laying down on your back, okay?
Okay.
You can even ask a family member, let's say you want to come visit, or you roll yourself over and they can check those bony parts, okay?
Okay.
So you've been doing really well. Today we're going to be working on your balance and your strengthening. So we're going to do some exercises here on the mat, okay? So first what we're going to do, you're going to have your hands here at the side. Try to pick them up just a little bit. We're going to start with one arm first and then the other one. And we're going to see how strong we are and try both of them, okay? Let me be behind you. So go ahead. Very good. How does that feel?
Good.
Okay, let's try your other hand. Very good. ready to challenge yourself a little bit?
Yeah.
Let's try using both of your arms. Okay, we're gonna have to work on that, but that's okay.
I can do it again.
Okay, let's go ahead and try it. That's better. Okay, wanna try it one more time? There you go. Feeling stronger as you do them? Yes?
More confident.
Okay, let's move on to the next one. Now, since you've gotten stronger from your arms, what we're gonna do is you're gonna pick up your butt and go down. Okay? There you go. Yeah? Exactly. Good. Okay. Now the last one we're gonna do is gonna be with our legs. So you're gonna be here. I know your strength has gotten a little bit better. You're gonna grab your foot, hold yourself up, bring it to the side, in. One leg first, and then the other one. It's okay if it drags. I'm gonna be behind you just in case you lose your balance. Exactly. Just as much as you can.
Same leg?
Yes. Good. Let's try the other leg now. Very good. You see how your gripping has gotten better? One more. Very good, Mr. Mata. That's all our exercises for today. You did an awesome job.
Shimata, we're gonna work on some exercises, and it's called the tenodesis grasp. Okay, and what it consists of is moving your arms, or your hands rather, and just with this simple motion, it's gonna allow your fingers to get some functionality out of them. Okay, so when you bring your wrist forward, it's gonna open up your fingers, and you bring them back, and your tendons are gonna go ahead and retract the fingers, and that'll allow you to do a functional grasp. Okay, can you go ahead and try that for me?
I think OT was trying to teach this to me earlier, but I wasn't really understanding it.
Okay. Well, what didn't you understand about it? That way we can go ahead and clear it up right now.
Actually picking it up, picking items up, I don't know how I could actually pick this up.
Okay, so we'll start off with a large item right here.
Okay.
Actually, let's go ahead and do the water bottle. Okay. So if you go ahead and place your hand over it, go ahead and put it over it, and the moment that you start bringing your wrist up, it's gonna go ahead and your tendons are gonna pull on the fingers, and it's gonna allow you to make that grasp.
Okay.
And then when you bring your wrist forward, it'll allow you to drop it. Okay.
So
Can you go ahead?
Is it not too heavy? Let me try.
If it is too heavy, we can try with a lighter item. Can you try that? Okay, so let's go ahead and try this item right here. Go ahead and try to grab that.
Can't really reach it. Is it okay if I do this?
There you go, perfect. Make sure you get your fingers over it.
Yeah, you can do this. This is what OT was teaching me last time, but they didn't explain too much. They just had me doing it.
Okay. So again, just with the simple action of you moving your wrist forward and back, it's gonna allow your fingers to help you with that grasp technique, okay?
Okay.
Very good.
Can't
Go
trust
ahead and
me.
try this item right here. Go ahead and press it. A little slower. It's okay.
I
Try
got
it a little slower. There we go.
Excited. It means I can feed myself. I can stop relying on people to feed
Absolutely.
me, right?
Yeah, you sure can feed yourself.
It's awesome.
Very good.
You need to do repetition?
Yes, we do. There you go. Very good, Mr. Mata.
That's it.
Hey, Dr. AC.
How we doing?
Doing better.
Let's look at your chart here. I saw you were finishing up your exercises. How's that going?
Yeah, the PT department has really showed me a bunch of exercises that
They
helped.
have, right?
Yeah.
So now you know that PT really does help you. Okay, so I have here an order for you to be seen in a home visit pretty soon. Is that all right?
Yeah, the PTAs, we're gonna go visit me at home. We're gonna continue with the treatment. I really want that, cause it's been really helping me out.
I get that, I understand. Well, looks like we're ready to discharge you already. Let me just write some notes here.
Yeah, I went from just laying down on my back to being able to move around in bed, so
Okay.
I like it.
Gnarly. Okay, Mr. Mata, so we're all set, ready to go, okay? Thank you so much.
I want to thank the people that helped me from you, and you, from helping me going from my bed to being able to do stuff for myself.
Like 3 and then 3 and then 4. 5. 1, 2, 3.
And we're rolling. Go for it.
Yeah, go. He fucking hit my dad bod, dude.
Then maybe you should jump over first and then go. Call 911. Alright. Okay, CPR.
Hey guys, on the elevator.
First,
Oh no, that's a good yeah.
Just keep going.
You told me to.